1 year ago, the attention of the world was focused on COVID deaths. Several months later, surging COVID cases. And now it seems everyone is in a race against time to secure and administer COVID vaccines. And how is Canada faring in the global competition for vaccines? Apparently, not all that well, according to CNN, who just recently covered this very point. Take a look at this clip.
And Jake, look, this is a problem. You have to rewind decades to really get to the heart of this problem, but that doesn't let the Trudeau government off the hook. They've been in power for more than 5 years. They heard the dire predictions. This country for decades had a competitive advantage in making vaccines. The research was right here. But look, Canadians will now pay for that complacency. Trudeau promises that domestic manufacturing will ramp up next year. Jake, you and I both know it's just too late at this point in time. This third wave is punishing. I am speaking to doctors, especially in the hotspot of Toronto.
Some tough words, especially from our neighbors south of the border. But Canada is clearly lagging behind. We rank 47th in the world in terms of total number of doses administered, tied with Romania. Something I find of particular interest that is most interesting is that most of the required vaccines, or most of the vaccines require 2 doses administered, 1 month apart. But some Canadians who have received their first dose are concerned as now they have their second dose scheduled for as much as 4 months later. Even though many Canadians are eager to get a COVID vaccine, there are still a large percentage who are refusing. In some cases, 50% of frontline medical staff are simply saying no. And with recent concerns about blood clots with the AstraZeneca vaccine in some countries, and the pausing of the Johnson & Johnson vaccine in the US because of blood clots again, Canadians are hesitant to get the jab. And there still remains questions surrounding the COVID vaccine's testing, safety, and efficacy among scientists, research, doctors, and lay people. Well, later in the program, I will be joined by physician Dr. Stephen Malthouse of British Columbia to discuss some of these concerns with COVID vaccines. But now I'm joined by physician Dan Riley of Ontario, who will update us on how the vaccine rollout is faring and what Canadians can expect in the coming days with respect to their vaccines. Dr. Riley, thank you again so very much for joining me today. You're a physician in Ontario. We are locked down again. So many Canadians and Ontarians specifically are saying, where's our vaccines? How do we reopen this economy? Is the vaccine the path forward? So I guess I'll start with that question. Is the vaccine the path forward to getting us out of this COVID lockdown situation?
It certainly appears to be at the moment. When we look at the Ontario stats in the long-term care and the over 80 population, cases are actually way down. The vaccine seems to be working. And if we can spread that success to the whole population, then I think we can get ourselves back on track.
Well, that's good news to hear, because obviously LTCs were the COVID hotspots, and they've experienced the greatest number of deaths, percentage-wise at least. So that would be great if we can finally get that situation under control. So as vaccines are now being rolled out, so in your opinion, how has Canada fared? We've heard some grim words from CNN just in my opener there. How do you feel we are faring in this race for vaccines in Canada?
So the rollout seems to be frustratingly slow. It seems to be that the federal government was slow to get vaccine into the country. Ontario is struggling to get it out into arms. The current stat is that about 80% of the vaccine that we've received, we've gotten into arms. It'd be much better if that was 95%. But it's slower than it could or should have been. And that's disappointing.
And I know that we're starting with the most at-risk population. So obviously with those 80 plus, and then they bring it down to 75 plus, now 70 plus. And I believe, I guess in Ontario, again, 1/3 of the Canadian population lives in Ontario. It's now, I believe, I think we're at 55 plus. Have I been too generous there?
So in most of the province, it's 55 plus. In hotspots in Toronto, they're trying to take it down to anybody over 18.
Okay. And where can people get these vaccines right now? It's no longer just happening in medical centers. I think you can even go to pharmacies now. Am I correct?
Yeah. Yep. So part of the challenge is there's a bit of a patchwork. So if you're 55 or older, you can use the provincial website to get either a vaccine center or a pharmacy appointment. The problem is in the hotspots in Toronto, it seems like you have to use a website related to that particular pop-up clinic. So it's a bit of a patchwork. But certainly if people have a family doctor or somebody they know in the medical system, give them a call and say, how do I access it? And can I access it yet?
Yes, and
but if you're 55 or older, access the website and you've got an appointment.
And even in some of the hotspots in Toronto, in the Toronto community housing, some of the lower income housing, I know there were vaccines being administered door to door even in some cases. So definitely, you're right, a patchwork system, and in some cases it's working well. In some cases, probably more room for improvement.